Welcome to the Open Enrollment Information Presentation. Open Enrollment is your once-a-year opportunity to review your Ohio State benefits and choose what works best for you and your family. It's important to take a few minutes to look at your options, review the 2026 plan year changes, and determine your needs. This is the only time of year when you can make changes to your benefits unless you have a qualifying life event like getting married or having a baby. We encourage you to review your benefit information in Workday and visit hr.osu.edu/OE. These resources can help explain the benefits and coverage options. During this presentation, we will provide general information about open enrollment, discuss the elections you can make during the 2-week open enrollment period, review the major changes for the upcoming plan year, and explain how to enroll in your benefits. We will start with an open enrollment overview. This overview will provide some key communications as well as an open enrollment timeline. Now let's review some important dates for this year's open enrollment. An open enrollment mailer will be mailed to the homes of eligible employees in late October. The open enrollment window will start on October 31st and remain open until November 15th. During this period, elections can be completed online via Workday at workday.osu.edu. You will have a chance to review your open enrollment elections in the confirmation period, which will take place after Thanksgiving. Any benefit changes or elections made during open enrollment will be effective the start of the next plan year, January 1st, unless an evidence of insurability, EOI, is required. Open enrollment provides employees an opportunity to verify all employee and demographic information is current and correct. It is important to keep your address and contact information up to date to ensure you receive communications in a timely manner. Keeping this information up to date also helps to ensure the accuracy of Affordable Care Act ACA reporting to the IRS. Please verify that the names, government IDs, and date of birth on file for each covered dependent identically matches the IRS records. If you cover a spouse or dependent child on your medical benefit, you will receive an annual request for information about any other medical coverage they may have. If you registered with the Luminaire portal and requested to receive communications electronically, you will receive an email asking you to log into your account to respond to this request. Your response is required even if your dependent does not have other coverage. In instances where an individual is covered by more than one plan, you will be asked for additional information to determine which plan is responsible for primary coverage to ensure accurate claim payment. Luminaire Health will send this request for additional coverage information in January. Failure to provide this information by the requested due date will result in delays in claim payments. If you would like to change your communication preferences with Luminaire, please register on the Luminaire portal. You are encouraged to review dependent eligibility requirements for each of the dependents currently on your medical, dental, and/or vision coverage, as well as any dependents you intend to add during open enrollment. Ohio State requires employees to verify eligibility for any dependents enrolled in the medical, dental, and vision benefit that has not yet been verified. A Light Dependent Verification Center conducts dependent eligibility verification on our behalf. A dependent eligibility verification packet will be mailed to your home address from a Light in January. The packet will include any dependent covered on Ohio State's medical, dental, and/or vision benefits whose eligibility must still be verified. When your packet arrives in the mail, follow the steps to submit the required documentation by the deadline stated in the packet. Please note, failure to provide proof of eligibility for each applicable dependent will result in termination of their coverage. Next, we will review your enrollment opportunities during this open enrollment period. During this open enrollment period, you may add, drop, or change your current medical, dental, and vision coverage. If you make no changes to your current elections for medical, dental, and vision, they will carry over to the following plan year. The exception is Prime Care Connect, which requires an annual reapplication. Open enrollment is your opportunity to review and add or drop dependents from your coverage. If you want to participate in an FSA in 2026, you must enroll during open enrollment. FSA elections do not carry over from the prior plan year. You may elect, waive, or change child voluntary group term life insurance elections for your dependent children up to the age of 26. You may elect, waive, or change voluntary group term life insurance coverage for you or your spouse. Short term disability coverage may be elected or waived during this open enrollment period. Next, we will review the benefit changes effective January 1st, 2026. For the 2026 plan year, Ohio State will offer an increase to healthcare and dependent care FSA contributions, medical, dental, and vision plan contribution rate changes, a new employee wellness portal for Your Plan for Health, YP4H, Prime Care Connect eligibility update, a short term disability special enrollment, as well as voluntary group term life insurance special enrollment, and a GLP-1 anti obesity medication update. Beginning January 1st, 2026, the maximum contribution limits for both the Healthcare and Dependent Care Flexible Spending Accounts, FSA, will increase. Although the 2026 Healthcare FSA contribution maximum is pending release by the Internal Revenue Service, IRS, it is expected to increase to $3,400. Our plan will allow you to elect up to the finalized IRS maximum amount. A healthcare FSA allows you to set aside pre tax money to pay for eligible healthcare expenses for you and your qualified dependents. Examples of eligible expenses may include health plan deductibles, coinsurance, contact lenses, prescription drugs, dental care, including orthodontia, and over the counter medications. The dependent care FSA maximum will increase to $7,500 or $3,750 if married filing separate for the 2026 plan year. A dependent care FSA allows you to set aside pre tax money to pay for eligible dependent care expenses for your qualified dependents. Eligible dependent care expenses are those incurred to allow you and your spouse, if married, to work, look for work, or attend school as a full time student. Examples of eligible expenses may include child care facility fees, before school and after school care, or local day camp. For both of these spending accounts, you must incur eligible expenses from January 1st through March 15th of the following plan year, and reimbursement requests must be submitted by March 31st of the following plan year. Funds that are not reimbursed from your FSA by March 31st will be forfeited. The funds that you contribute cannot roll over from year to year. Ohio State is not making changes in 2026 to the amounts you pay for covered health services, such as deductibles and out of pocket maximums. However, along with medical costs that are growing nationally, our costs are also increasing. Since you share in that cost with Ohio State, the employee contribution amounts that are deducted from your pay will increase in 2026. The amount of this increase depends on a variety of factors, including the plan and the coverage level you choose, your full time equivalency, and compensation tier. You will also see slight increases in dental and vision plan contribution rates. A new wellness portal will replace Personify Health as your digital hub for accessing YP4H wellness benefits, earning incentives, and participating in university wide challenges. The Personify Health portal will close on December 31st, 2025. Prior to that, make sure to complete your annual Personal Health and Wellbeing Assessment, PHA, and verified biometric health screening to receive the 2026 $300 credit to reduce your medical plan contributions. Stay tuned for additional communications and webinar opportunities this winter to learn more about the new YP4H program coming in January 2026. The Prime Care Connect benefit option is designed for those with limited household income and intended to eliminate some of the financial barriers to obtaining necessary health care. The premium rate is the same as Prime Care Advantage. Savings are realized through lower out of pocket costs due to reduced copayments and coinsurance. In order to be eligible for Prime Care Connect, you must be a full time Ohio State employee with an FTE of 75% to 100% who is eligible for the full time medical contribution rates, and your household income cannot exceed 225% of the federal poverty guidelines. A special application is required to participate in Prime Care Connect, and the current enrollees must reapply each year. To get your application, contact the OSU Health Plan at 614 292 4700 or download the Prime Care Connect application available at osuhealthplan.com. If you want to ensure medical plan coverage through Ohio State, you should enroll in one of the other medical plan options while your application for Prime Care Connect is being processed. Enrollment into Prime Care Connect will automatically be updated if your application is approved. This year, you have a special enrollment opportunity for short-term disability (STD) coverage without an evidence of insurability (EOI), and with premium rates up to 10% lower than last year's rates. Open enrollment for STD benefits without EOI is typically not offered each year, but only during specially designated years. Enrollment outside of this year's open enrollment opportunity may require EOI and must be approved by UNUM, Ohio State's Disability Benefit Administrator. If you wish to cancel existing coverage, you may also do so during open enrollment. During this open enrollment, eligible employees may elect to purchase additional employee and/or spouse voluntary group term life insurance, VGTLI, with no evidence of insurability, EOI required. Enrollment outside of this special opportunity may require EOI and must be approved by Ohio State's Life Insurance Administrator, Minnesota Life Insurance Company, a Securian Financial Group affiliate. For employees not currently participating in VGTLI, they can elect 1 times their annual salary without EOI. For employees currently participating in VGTLI, they can increase coverage by 1 times their annual salary without EOI. Increases are subject to plan maximums and age reduction. Employees not currently participating in VGTLI spouse coverage can elect $25,000 without EOI. Employees currently participating in VGTLI spouse can increase current coverage by $25,000 without EOI. Increases are subject to plan maximums and age reduction. During open enrollment, you have the opportunity to enroll in or increase VGTLI child coverage for eligible dependent children up to the age of 26, with no EOI required. The only other time you can enroll in or increase coverage is with a qualified status change. The maximum amount of coverage available for each eligible child is $20,000. Starting January 1st, 2026, GLP-1 medications will only be covered by the Ohio State University Faculty and Staff Health Plan when they are prescribed for treatment of type 2 diabetes. GLP-1 coverage for any other uses will be discontinued. These medications and their generic equivalents include but are not limited to Wegovy, Saxenda, and Zepbound. The decision to eliminate coverage for these drugs comes after careful consideration to balance exceptionally high costs of weight loss medications with our commitment to providing access to affordable benefits for all eligible employees for years to come. Plan coverage for GLP-1 medications will continue when prescribed for treatment of type 2 diabetes, and the plan's medical criteria has been met. Other medications currently approved for weight loss, such as phentermine, Cucia, and Contrave, will continue to be covered. Ohio State is committed to helping you make the most of your benefits and learn ways to keep coverage as affordable as possible. Rising healthcare costs can be challenging, which is why we provide education, tools, and programs to support you. By taking part in Your Plan for Health, YP4H, you can earn a credit to reduce the amount taken from your pay for medical coverage. To receive a $300 credit in 2026, be sure to complete the following two steps by December 31st, 2025. First, complete the Personal Health and Wellbeing Assessment, PHA, and then complete a biometric health screening. Earn an extra $180 credit when your enrolled spouse also completes these steps by December 31st. You may also earn tax-free health reimbursement account (HRA) dollars by participating in wellness activities, like tracking your daily steps through the Your Plan for Health incentive program. Use HRA funds to cover eligible health expenses like deductibles, glasses, or prescriptions. Get the most from your benefit dollar. Complete annual checkups and preventative screenings. They are covered at no cost and can catch issues early, keeping you healthier and saving money long term. Use network providers to receive quality care at the lowest cost. These are doctors, hospitals, and care providers who have agreed to offer services for our medical, dental, and vision plans at contracted rates. Track your healthcare spending with Luminaire Health's website or app to see how close you are to meeting your deductible and out of pocket max, helping you plan and make informed decisions. Within the medical plan options, Premier and Standard network providers are available. Your out of pocket costs will generally be lower if you see a Premier network provider because the plan pays a higher percentage of the cost. How to enroll in Workday during open enrollment. To make online open enrollment elections, log into Workday at workday.osu.edu between October 31st through November 15th and click the open enrollment event located in your Workday inbox. Once the event is open, make elections and then upon completion, print and save your benefit summary. Once you have submitted the open enrollment event, you can make changes to your online elections from October 31st through November 15th by clicking Open Enrollment in the announcement section of your Workday home screen. For more detailed information regarding open enrollment, please see the website at hr.osu.edu/OE. If you have questions regarding your benefits, you can email HR Connection at hrconnection@osu.edu or call HR Connection at 614-247-6947.